Pressing ahead with phase 2 of the National Health Insurance Plan, which has been budgeted at $100 million. Phase 1 began in January, and as it moves ahead, the N.H.I. Secretariat is pushing to have more people registered.
Despite continued opposition from some medical professionals, a major union also said to be impacted by N.H.I. is stating its position on the scheme. Cleopatra Murphy has more.
More than 240,000 Bahamians will be able to enroll in N.H.I. Bahamas when Phase 2 of the plan begins in 2017. But National Health Insurance Secretariat Permanent Secretary Peter DeVoe-Isaacs says approximately 100,000 will not because they have not applied for their smart cards. Phase 2 will begin with registration for primary care providers in January. However, DeVoe-Isaacs says patient enrollment is dependent on provider registration. He says feedback has been encouraging.
Health care reform requires collaboration and time with many stakeholders, and I know that our team has struck the right balance in engaging stakeholders as we move towards bringing relief to hundreds of thousands of struggling Bahamians with respect to health care.
President of the Bahamas Doctors Union, Dr. Charles Clark, says despite the outcry against N.H.I. from some specialists, the union that represents some 300 primary care providers supports N.H.I. Despite facing a reduction in payment, he says some of the doctors' concerns have been addressed.
You're never going to actually have everything met, but certainly given the greater economic situation in the country, and mindful of the need to actually offer health care to people who are marginalized and disadvantaged in this economically challenging time. I think this is a great initiative, and certainly we will be a part and supporting its endeavor.
N.H.I. Project Manager Dr. DeLon Brennan says the Secretariat has engaged healthcare providers throughout the year, and almost 70% say they will sign up. Payment for doctors has been a big part of the N.H.I. debate, and Brennan says the Secretariat has 3 payment options.
One option for physician reimbursement is to become a fee-for-service primary care physician provider, where the services will be reimbursed using a simplified fee schedule. A second option is the capitation model, whereby physicians will be reimbursed for each individual who signs up to be in their panel of patients. A third option is to sign up for N.H.I. Bahamas maternity care or infant care bundles, where physicians will be reimbursed for a package of services that are determined to be essential for pregnant women and infants up to 2 years of age.
Brennan says the models were based on what the country could afford and conforms with international best practices. He says improving the quality of patient care was also a focus.
A number of controls have been put in place to improve quality of care for all beneficiaries, such as setting a maximum limit on the number of patients a full-time physician can have to ensure they spend a sufficient amount of time with each patient.
Officials say they will be ramping up efforts in the next few months to encourage more people to get N.H.I. ready. Cleopatra Murphy, ZNS Network News.